Good evening, Dr. Amit.
Good evening, buddy. Nice to see you. I really love the Portuguese session. I think everyone should join early so that you don't miss a single word from the Mind Your Language Portuguese session. I really loved it, and I love the way each session is
Session.
getting better and better and better. I love the small things that Shanti spoke about. The S before a consonant becomes a sh. So I kind of remember those things. So I can tell Burley also, vestido azul. I hope I got that right. So this is the season we need to spread joy. But during the monsoons, some other health problems also spread around. I told you about dengue once before. Dengue is still spreading. So be very careful. Remember the tips I gave you as far as the prevention of dengue is concerned. The other infection that we are seeing these days is the problem of conjunctivitis. You see, conjunctivitis, or simply known as sore eyes. Now, what is conjunctivitis? The eye has a thin membrane covering it, and that is called the conjunctiva, and that has got inflamed. When that gets inflamed, you get a red eye, and that is conjunctivitis, sometimes called a pink eye. So basically, it's the inflammation of the conjunctiva. There are a lot of misconceptions regarding this, and I thought I'd just clear them off. Some people feel that if you look at someone with sore eyes, you will get sore eyes. So it doesn't spread that way. It's not like looking at somebody is going to give it to you. No, it doesn't spread that way. It spreads because all the secretions from the eye, they are contagious. So if you touch anything that secretion was on, say if the person is a student and has wiped the eye and then touched a pen and then shared the pen with someone else or shared a book with someone else, then the book will carry the secretion, and when that person touches the book and then touches the eye, the disease spreads. It's very contagious. So if there are people around you, there are high chances that you could pick up the infection, and that's why it is spreading not only in Goa but also in other parts of India. So we have to be a little careful about that. uh, we feel sometimes that sore eyes are always contagious. No, it's not always contagious. It depends on what is the cause of that infection. So if it's an infective one, bacteria or viral, it would be contagious. Sometimes sore eyes could be caused due to trauma, or sometimes it's caused due to allergy. So these are not contagious. But the one that is spreading right now, the one that's spread is the contagious one. So be a little careful about that one. Sometimes we feel that, okay, as adults, we will not get it, only children get it. More children tend to get it because they go to school and somebody or the other has the infection, they pick it up from there and don't follow precautions. But even adults can get it. We sometimes feel that because we got the infection once, we will not get it again. No, again, that's not true. Even if you got the infection once, you can get it again, because there is kind of no immunity to conjunctivitis. So you can still get it again. So what should you do? Should you worry? What you should do? Now, one is, as far as possible, stay at home. And the reason why I'm saying stay at home is we don't want this outbreak to spread further. We don't want to give it to other people. And so, if we are a little conscious about that and we care for other people, we would try to avoid going to school, or we would avoid going out into a crowd, or avoid meeting people, avoid shaking hands. The same precaution that we took to try to prevent COVID from spreading, we need to take the same precautions over here as well to prevent the spread of conjunctivitis. So stay at home as much as possible. Now, how long do you stay at home? How long should a student or your grandchild should stay at home? So the grandchild should stay at home till such time that there are no secretions. As long as there are secretions, the person would be infective to other people. It is not the redness. Sometimes there is redness because of some other reason of the other things that happen inside the eye. Maybe a subconjunctival hemorrhage. It may look horrible, but it will take its own time to heal. That person is still not contagious to others. Will not be a danger to other people. But if there are secretions, then that person would be can transmit the disease to other people. So be careful. Wash hands regularly, because it's through our hands that we touch our eyes that will spread it to other people. So wash hands regularly. Keep your clothes, your linen, your towels separate. So the more you share, the more someone else touches it to go to wash your clothes, there's a possibility that they will get the infection. So keep that separate. Don't wear contacts. If you're wearing contacts, don't wear contacts when you're having conjunctivitis. Wear glasses. Avoid eye strain. So don't look at the mobile for too long. Don't look at the television for too long. If you're using the remote when you're watching the television, make sure that that remote is wiped properly, or someone else does not use that remote, because high chances that you could spread the disease through by touching the remote. So wipe it as much as possible. Don't put a patch on the eye. That's not a very good thing to do. Don't go to the swimming pool. Tell children, especially, don't go to the swimming pool if they have sore eyes, because that's one place they will just spread it to everyone else. So be a little careful. If it's getting worse, it's not getting better, if there is painful eye, there is fever, if there's a lot of discharge, you need to see a doctor. Then the doctor may prescribe eye drops that are soothing. You can wash the eye as well, and you can wash the eye. I feel it's nice to wash the eye with cold water, but some people feel better with warm water as well. Cold water will constrict the blood vessels, and so that gives you a good feeling. But if you feel better with warm compresses, it's either cold compresses or warm compresses that you can do to keep your eye, you know, irritant free. And you can use the eye drops that the doctor use. It's not always that you need to use antibiotics. Depends on what the doctor sees. If it's a bacterial infection, they would want to use an antibiotic, or an anti-allergic could be used accordingly. So take care of your eyes. Don't be afraid of this outbreak, but take care of your eyes and make sure that we do our bit to prevent the spread of the outbreak to other people. That's my tip for the day. Take care.